Now, I would like to introduce you to Alyssa Mages, a certified veterinary technician, who will go through how she trains pet parents to use an inhaler at home.
This program is brought to you by Trudell Animal Health.
Hi, this is Alyssa Mages, and today we're going to be going over the hands-on portion of how to train your cat or dog patient to accept their medication. It is common to treat feline asthma and other canine upper respiratory diseases with medication delivered through an inhaler. While this is effective in terms of treatment, some pets are not comfortable with the inhaler and can become sensitized to its frequent use. The last thing any of us, owner or nurse, wants to do is to battle with our patients or our pets to medicate them. The distress it can cause for both the owner and the patient can, over time, have a negative impact on the relationship between the owner and their pet, or even on the nurse and pet relationship. This can even lead to an owner avoiding using the inhaler with their cats or their dogs at home. However, it doesn't need to be like this at all.
As we all know, pilling pets, and especially cats, can be extremely difficult. Just think of how many memes express this problem. Fortunately, pets can easily be trained to accept inhalers for medication administration. In fact, most pets are comfortable with inhalers with a little training. Some cats can be trained to come running when it's time to take their inhaler medications. Why are inhalers preferred? Inhalers are preferred for long-term disease management because of the side effects of systemic options, especially corticosteroids, which is a common medication used for chronic respiratory disease. With just a little training, pet parents can administer medications at home to help during coughing flare-ups. In fact, a recent study from Tufts University showed that, on average, it only takes 4 to 6 days to train cats and dogs to use an inhaler.
When we carefully introduce these things and positively reinforce them through training, the acceptance and use can be well tolerated by a cat or a dog. We, as veterinary nurses, are in the ideal position to offer this training and support. After introducing the inhaler to the owner and explaining why it is needed and how it works, it is then important to ensure that the owner understands how dogs and cats learn and how their learning can be influenced in a positive way. After introducing the inhaler to the owner and explaining why it is needed and how it works, it is important to ensure the owner understands how their pets learn and how their learning can be influenced in a positive way. Through this understanding, owners will be more receptive to undertaking the steps needed at home to train their pet for successful use. So, we need to talk about how do pets learn. And we're going to be focusing mostly on cats, as training them is a little bit more challenging. Cats are learning all the time, regardless of whether they are intentionally being taught something or just going about their daily life. As an animal learns, it is developing negative or positive associations with the various things it encounters and interacts with. For example, it learns that certain things predict other things. It therefore associates two things together in its mind. These things can be sights, smells, sounds, touch, or a combination, and they can be good or bad. In order to associate that one thing predicts another, they need to occur one after the other, very close in time. For example, if a cat is fearful of the hissing sound an inhaler makes when it is depressed, it will begin to associate this sound with the sight of the inhaler, as every time it sees the inhaler, it learns the hissing sound comes soon after. Thus, the cat soon starts to show fearful behavior of the inhaler even before the hissing sound comes. Repetition tends to consolidate such behavior. However, it can sometimes take just one negative experience for a cat to learn to fear or become anxious of something. It is therefore much better to introduce the inhaler in a gradual fashion so that all of the initial experiences are positive. Undoing a negative association can be really difficult and time-consuming in comparison to teaching a positive association. Undoing a negative association can be difficult and time-consuming in comparison to teaching a positive association. Cats can also learn from the consequences of their behavior. When a cat behaves in a certain way, there is generally always a consequence. Whether the cat performs the behavior it performed again depends very much on how the consequence made them feel. For example, if an inhaler was placed on the floor and the cat chose to approach it and sniff it, and the owner immediately gave the cat a food treat that it liked, the cat would be likely to approach and sniff the inhaler again. This behavior led to a positive consequence. However, if the cat approached and sniffed the inhaler and the owner thought, brilliant, he's interested, now is time to use it, and subsequently picked it up and held it forcibly against the cat's face, the cat would be highly unlikely to voluntarily approach the inhaler again. In fact, he may actively avoid it, as the consequences of having it placed forcibly against his face, restraint, and a loss of control, were both perceived negatively. As with everything with cats, calmness and patience are key. Thus, the owner's role is to ensure positive associations are made with the inhaler, and interacting with it in the required manner leads to positive consequences as perceived by the cat. This is similar to with a dog. They need to acclimate to an inhaler in a very similar way. So, what is a positive consequence for a cat? What exactly is this going to look like? It is really important for the owner to think about what their specific cat enjoys. Food is usually going to be most useful in training, and therefore an owner should spend a bit of time identifying what their cat likes best of all. For example, this may be a commercial cat treat, a smear of cheese, a chunk of their wet food, or a small piece of shrimp or chicken. Training when a cat is hungry can also increase the value of the food, rewards, and motivate the cat to interact to achieve the food treats. Some cats also enjoy gentle interactions, such as petting or scratches under the chin, and some enjoy playtime, such as with a wand toy or chasing a ball or a toy mouse. However, the latter may be difficult to incorporate into the later stages of inhaler training, where the cat is required to stay still. In training terms, the positive consequences we give the cat, for example food, are known as reinforcers, as they reinforce the preceding behavior. In training, it is also very useful to associate the reinforcer with a marker word. By pairing the marker word, for example, good, with a reinforcer over several repetitions, for example, say good, offer treat, and repeat, the cat learns that the word good means the reinforcer is on its way. This is beneficial in training, as sometimes it is not possible to give the reinforcer at the exact time we wish to. For example, imagine the scenario where a cat approaches and sniffs into a space chamber which has been placed on the floor. This is a desired behavior that needs to be reinforced with a positive consequence, and so the owner calls the cat over to offer it a treat. But now what has actually happened is the behavior of walking away from the space chamber towards the owner led to the positive consequence of the food treat, not the approach and investigation of the space chamber. From the cat's perspective, the behavior of walking away from the space chamber towards their owner led to the positive consequence of the food treat, and not the approach and investigation of the space chamber. So, by using a marker word, this allows precise marking or pinpointing of the desired behavior, letting the cat know exactly which behavior caused the positive consequence. Why do some cats find the use of an inhaler distressing? Remember, it is much easier to create positive associations than to overcome negative ones. Therefore, The various components of utilizing an inhaler need to be broken down into individual parts and introduced separately and positively. Only once each one has been accepted separately should they be brought together. Doing this also helps you to develop a training plan with the client. A training plan should identify all of the various elements of inhaler use that a cat or dog may not feel comfortable with. These are having something new, the inhaler, in their home. For a few pets, even this will make them a little bit cautious. Being gently restrained in order to administer the medication. The pet's muzzle needs to be inserted into a small mask, and the pet needs to remain still for several seconds, the time it would take for 5 to 6 breaths, with the mask on its muzzle. Also, attached between the mask and the inhaler is a spacer chamber, which makes the device large in size in comparison to the pet's face. Depressing the inhaler will also create a hissing sound, which primarily cats are likely to find startling and possibly aversive. Wiping the face of the cat once the mask is removed with a slightly damp cloth, this is to remove any traces of medication which can sometimes cause a rash on the cat's face, can also be problematic. A training plan should also identify which order things should be trained in for a particular pet. While some things need to be trained sequentially, i.e. voluntarily placing of the muzzle into the mask should be fully established before moving on to building duration of this behavior, other behaviors could be trained simultaneously, although within different training sessions. For example, being calm around the sight and sound of the inhaler. Training steps to accepting an inhaler. You want to make sure that your cat or dog is acclimated to the individual sights and sounds of the inhaler. The very first steps are to acclimatize the pet to the sight, smell, and sound of the inhaler in the home. Depending on the temperament of the pet and how anxious it is, generally of new things, an owner may be better separating the inhaler into its separate parts of the mask, space chamber, and actual inhaler, and introduce these separately. Introduction is as simple as placing it on the floor and allowing the pet to voluntarily investigate it. Since the inhaler will have come in from the vet hospital and likely smell of the clinic, it is a good idea to have it in the home, out of sight from the pet, for a few days to let it lose that smell. Additionally, you can rub it over with a cloth or a glove that the pet has been petted with, providing that the pet enjoys this, so that it smells more familiar to them. The parts should not be presented to the pet, but simply placed near it, allowing them to choose when to investigate. Control and choice are critical for a pet to feel comfortable, especially cats. And when the pet does investigate them, the behavior should be positively reinforced, like a food treat offered or the pet petted or talked to in a kind way. Using a marker word can greatly help with the timing of the positive reinforcement. Once the pet is fully comfortable with the sight and the smell of the individual parts of the inhaler, they can be pieced together and further investigation rewarded. If the pet ignores the inhaler after initial investigation, but seems in no way concerned about it, we can encourage further investigation by placing treats near or on the inhaler. Separately to this, the pet can be trained to accept the sound the inhaler makes when it's depressed. We obviously do not want to waste medication, so a pressurized air duster, those cans that we clean our computers with, it makes a similar hissing sound, is ideal. To begin with, the sound can be muffled by placing a towel over the can when it's depressed and done at a distance from the pet. Every hiss sound should be quickly followed with a reward and should always occur at a volume that the pet can cope with. The pet should never feel anxious or worried by the sound. The pet will soon learn that the hiss sound predicts something positive. Number 2, ensure the pet is comfortable with gentle restraint. A pet should not be held against their will while an inhaler is being administered, but gentle restraint, holding the pet, may help keep them still and calm without preventing them from removing their head from the mask if they feel they need to. Having the pet sitting, facing away from its owner, with their hand gently placed around its chest may be the easiest position. For some pets, and these are the smaller ones, so cats and small dogs, being on their owner's lap may be the most comfortable. Gentle restraint should only last a second or two initially. A marker word is said, and the pet offered a reinforcer, and build this up gradually to increase the duration to the time needed to administer the inhaler.
My favorite place to go for more training tips is the International Society of Feline Medicine for step-by-step training. Check out the link in the comments section below.
There are multiple websites that you can refer to for gentle training, so head to Cornell or the University of Pennsylvania and check out their websites and see what they have to offer. Number 3, training voluntary positioning of the muzzle in the mask. The ideal situation is that every pet voluntarily places their muzzle into the mask and holds it there. Bringing the mask towards the pet and pushing it onto the muzzle should be avoided at all costs. Training success is met when the pet is reaching its head forward to get its muzzle into the mask at each offering of the mask. We can learn a lot from muzzle training in dogs using positive reinforcement. To learn how to do this, of course, you need to adapt it to a cat's particular needs. In short, the sight of the mask in an owner's hand should be associated with a reward, so the owner brings the mask out from behind their back so the cat can see it and rewards their calm behavior. This is repeated until the cat is showing signs of anticipating the reward on the sight of the mask. The next stage is to encourage the pet to voluntarily place its muzzle into the mask. Some pets may voluntarily place their muzzle into the mask as they investigate it. Others may need some encouragement in the form of a food lure placed inside the mask. For dogs, this may be a little bit of peanut butter smeared along the edge. Allow the pet to eat the treat within the mask. You can use a solid treat or a paste smeared into it, but keep the mask still. Never move it towards the pet's face. This always gives the pet a choice. The idea is that whenever the mask is presented, the pet chooses to place its muzzle into the mask. After lots of repetitions, the cat should do this even without a treat in the mask. Of course, once the muzzle is in the mask, a marker word should be given, such as good, and a treat delivered. In order to build up the amount of time the cat is comfortable with its muzzle in the mask, delivery of the treat needs to take more time and occur in the mask. This could be achieved by using a paste-like treat delivered in a syringe through the end of the mask that the pet can lick off the end of the syringe. Always remove before the pet pulls back out of the mask. You can even move the mask gradually away from the pet to encourage them to push their face forward and keep it inside the mask. Number 4. Bringing it all together. Once the pet is comfortable with placing its face into the mask for the required length of time, remember they have to take 5 to 6 breaths, the spacer and inhaler can be added to the mask. At this stage, it won't be possible to deliver the treat straight into the mask, so you need to get the pet accustomed to placing its muzzle in the mask for the required length of time, and then releasing when it hears the marker word for a food treat delivered out of the mask. Next, it is time to introduce the depression of the inhaler and the combination of the sound and the muzzle in the mask together. Ensure that rewards are plentiful and of really high value, not something that you would give them every day. If at any time a pet appears wary or overly cautious, it is always advisable to stop the training and go back a step or two, or even take a break to give them some time to recover. For veterinary nurses, here's some support for us. Owner success is going to be greatly influenced by how much support they have throughout the training. And this is going to go through the whole process. Talking it through face-to-face in the clinic and ensuring the owner has plenty of resources to refer to at home will greatly help. Handouts with step-by-step photos and access to training videos are a really useful resource for our pet parents. Quite often, owners rush through the training steps too fast or miss out vital steps that cause disengagement from their pet. Being on hand for phone calls or email supports throughout the process will help prevent an owner's giving up on the training and ensure that compliance is maintained. There is always going to be an opportunity to do further reading, and we would encourage you to do so, but this is going to come from multiple resources, so do your homework. Head to reputable sites, look on VIN or other universities that you know have reliable and relatable information to ensure that you can then easily translate that and carry it forward to your clients.
So let's go over what we have learned in this module. 1. Using an inhaler is preferred to other types of long-term therapy. It is better for the pet because there are fewer chances of the severe side effects that you can see with systemic medications. 2. Any pet can be trained to readily accept an inhaler with just a little work. And 3. Vet techs play a key role in building pet owners' confidence for long-term care of chronic disease. You can make a difference by training your clients on how to use inhalers appropriately.
This concludes the hands-on training. Please make sure that you like, share, and comment. And for more great tips, follow me at Empowering Veterinary Teams. Thank you so much for joining me today.